So today we're gonna go with wrist hand joint complex accessory motion assessment lab. I'm gonna raise the plinth so that he can relax his forearm on the plinth. And so I'm gonna perform I'm gonna assess a joint play motion that's necessary for all classes of movements at the MCP. All right. So this is gonna be assessing distraction of the MCP. I'm gonna start with the second MCP. So come here. Now I'm using my wedge. So the wedge is significant. This wedge is important. I'm using this wedge to stabilize the second metacarpal. And if I assess the third MCP joint, I will stabilize the third metacarpal, fourth and fifth, and so on. This wedge is also going to help me to place this joint in a loose pack position of about 10 degrees of flexion. Anywhere between 10 to 20 degrees of flexion is a loose pack position for the MCP joint, PIP joint, and DIP joint. Remember, understanding the loose pack position and closed pack position has significance, because when we assess accessory motions, we're going to be assessing accessory motions in the open pack position. Okay, so I'm gonna make sure I have him into some slight flexion at the MCP. All right, I have the first MCP stabilized against the wedge, and I have him flex to about 10 to 20 degrees of flexion. And now I'm gonna bunch up the skin. So you see what I'm doing, how I'm bunching up the skin? Why am I bunching up the skin? So taking out any resistance with the skin, I'm not mobilizing skin. So now I'm distracting his MCP joint. So now I'm distracting and providing an inferior pull or force. I'm gonna come back and make sure my forearms align. So forearms in line. So force is in alignment with my forearm. Okay, and so he should be able to feel that distraction. So his distraction is smooth. Okay, so I don't feel any type of resistance with his distraction. All right, I feel a normal ligamentous infield with that. So nothing really stands out to me that would jump out to me as abnormal with assessing his distraction. All right, so again, I stabilize. So I can also get a grip like this. I can use a grip like this. Make sure he's flexed. So he's flexed right at the MCP joint. And now I forgot to bunch up the skin. So I'm gonna bunch up the skin. And now I'm gonna apply my distraction force. Okay. So his distraction is nice and smooth. I don't feel any type of aberrant motion. Okay. Mobility wise, it's symmetrical. All right. No hypo or hypomobility compared to the non-involved bone. So the mobility was symmetrical. And so that he would be normal. He would be a grade 3 on the Stanley Parry scale for accessory motions. Okay, this is a movement that's necessary for all motion. So whether it's flexion, extension, abduction, adduction, and component the joint plate motion for distraction will help with improving that. So the next glide at the MCP joint is a volar glide. All right, now this is a component motion. This is a component motion that is necessary for MCP flexion. What's another term that can be used besides volar? Anterior. What's another term? Palmar. So we need to know our interchangeable terminology that you can see on a National Physical Therapy exam. I'm gonna stand on this one. So sitting is not good for this one, because we want our line of force to be aligned with our forearm, okay? So if I'm sitting, I don't get that good alignment. So I'm gonna come right here, and again, I'm stabilizing like so, bunching up the skin. I'm gonna unweight a joint. What I mean by unweighing a joint, I'm doing like a grade 1 distraction when I unweight a joint. And then now I can apply the volar glide, which is what I'm doing right now. So my force is going anterior. So it's an anterior force. Okay, I could do the same thing for whichever MCP joint that I want to do. Making sure I got alignment. So you also want to check for alignment as well. So what kind of alignment do I want to check for? I want to check for his first metacarpal being aligned with his proximal phalanx of the second finger. And I come in. As I stabilize, I'm going to bunch up the skin. I got my MCP joint flex and slight flexion. Remember, you want a slight flexion anywhere between 10 to 20 degrees. You see how I got the skin bunched up? I'm going to unweight the joint with a grade 1 distraction. And then now I'm going to apply my volar glide. And I'm sensing the mobility that I'm able to achieve with this glide, the quality of the movement in comparison with the other extremity. So, but that's a component motion that's necessary for MCP flexion. All right. Now I'm gonna go ahead and I'm gonna jump the gun, because the MCP, PIP, and DIP, they're all gonna have the same glides that are necessary for flexion. All right, because they function like little knee joints. So I can come up like so and do the same thing. This wedge is my friend. All right. So this wedge is my friend. So now I can stabilize the proximal phalanx. I can bunch up the skin, make sure it's in slight flexion. I can unweight it with slight distraction. You feel that, Tavian? And then now I can apply my volar glide. Okay. You want to make sure that that the joint line is not blocked by the wedge. Notice alignment is there. I'm bunching up the skin. You all see that? I'm also making sure that he's flexed at the PIP. I'm unweighing the joint. And then now I can apply my volar glide. So now we're going to do the dorsal glide of the base of the face. So this is a component motion that's necessary for extension of the MCP, PIP, and DIP. I got to again check for alignment. I got to make sure that the wedge is not blocking the joint line. All right. And then what position do I need the PIP in? Slight flexion. So you got to remember that when the person goes supinated, you still got to get the MCP joint in slight flexion. All right. Now I'm gonna get the MCP joint in slight flexion. Again, I bunch up the skin, I unweight the joint, and then I apply my dorsal glide. You all see that? I'm applying my dorsal glide. And I'm taking him as far as I can take him, which is a grade 4. My force is going this way, okay? My force is going towards the ground. I'm gonna come right here. Again, checking for alignment. What alignment am I checking for? Making sure his phalanx is aligned, proximal phalanx aligned with the second metacarpal. And now I'm gonna bunch up the skin, make sure he's slightly flexed. Make sure he's slightly flexed. Unweighted joint with like a grade 1 distraction. And now I'm applying my dorsal glide, like so. So we're gonna assess the component motion that's necessary for index finger MCP abduction, okay? So this is gonna be a radial guide of the base of the second phalanx. The second proximal phalanx, base of the phalanx on the second metacarpal. I want to assess the component motion that's necessary for second MCP abduction. So if I'm going to anatomical position right, this is abduction, moving away from midline. So this is my second MCP moving away from midline. So remember, our motion is described in reference to the anatomical position. So again, I'm gonna utilize my wedge. All right, I'm gonna bunch up the skin, make sure that I have her in a loose pack position of flexion, and then my thumb is on the ulnar aspect of the proximal ulnar aspect of the proximal phalanx. All right, and I'm mobilizing the base of the second proximal phalanx on the second MCP and imparting a radial glide. Okay, so radial glide meaning towards the radius, towards the thumb, like so. So this is my line of force. All right, and so again, this is a motion required for MCP abduction. Using my wedge, bunching up the skin. I've already told you my hand placement. I'm gonna unweight the joint, scoot back, and apply a radial glide. All right, so now we have the ulnar glide of the base of the phalanx, and this is a component motion that's necessary for MCP adduction. Come across the body. Make sure I have her flexed in the loose pack position, and then now my thumb is on a radial aspect. So my thumb is now on the radial aspect of the proximal phalanx, but I'm not going across the joint line. You know, I'm caudal to the joint line so that I'm not blocking the joint line. All right, I'm bunching up the skin, weighing the joint, and now I'm applying a radial, not a radial, ulnar glide. I'm applying an ulnar glide, okay, to improve MCP adduction. So again, using my friend, my wedge is my friend. It's gonna also help me place the joint in a loose pack position. It's gonna help me with bunching up the skin, loose pack position, unweighted joint with a slight distraction, and then again, applying an ulnar glide, which is a component motion necessary for adduction, MCP adduction. Now you have to go through your mind and process this, because at your fourth and fifth MCP joints, your motion is gonna change, okay, at your fourth and fifth MCP joints, right? So now, if I wanna improve abduction, right, at say my fourth MCP joint. So you see abduction, so turn like this. So your abduction at the fourth MCP is moving away from the midline, but it's moving towards the ulnar, right? So if I come back right here, right, and I want to improve abduction at the MCP of the fourth MCP, so I'm going to be mobilizing the proximal phalanx, the base of the proximal phalanx of the fourth phalanx on the fourth metacarpal. So watch what's going to happen. So now I come across, loose pack position, inflection, bunch up the skin. Now I'm mobilizing in the ulnar direction to improve what? Yes. So my component motion, so again, I'm moving concave on convex. So now my motion has to be in the same direction as my movement, which is abduction, which is away. So this is gonna be my fourth right here. So I got a slight flexion, unweighted joint, and now I'm applying a radial glide. So my mobilizing hand is on the ulnar aspect, or the medial aspect of the proximal base of the first phalanx. My force is going this way. So that'd be a component motion required for abduction. So the dorsal and volar sweep stretch at the syndesmosis at the metacarpal. Again, this is a joint play motion that's necessary for closing and opening the hand. So basically the thumbs are contacting the second and fourth or fifth metacarpals, and then we're applying a volar force and a dorsal force to sweep. So when we close our hands, so you see when we close our hands, what are the metacarpals doing when we make a fist? So when we make a fist, the metacarpals are moving dorsally. When we extend and open our fingers, the metacarpals are moving volarly. Can you picture that? So now you see my thumb contacts. So one of my thumbs basically on the first metacarpal, my right thumb's on the first metacarpal, and my left thumb is on the fourth metacarpal. Now I can also have a placement. I can bias my thumbs a little bit and put them in between the first and second, and I can bias and also put them in between the third and fourth metacarpals. But anyway, what I'm going to do to generate a dorsal sweep, I'm going to mobilize in a sense, and also I have my fingers. So I have my index finger, which is my second finger, and my third fingers also on the volar aspect or palmar aspect of the respective metacarpals. And so I'm gonna bunch up the skin on this one. So you see how I'm bunching up the skin on the dorsal aspect, and now I can perform a dorsal sweep by moving my thumbs and forearms in a sense outward. Okay, so it's like I'm moving them away from each other. So I'm moving my thumbs away from each other. So now this is what we call sweeping on the dorsal aspect, and so that's what we call our dorsal sweep. Okay, now I want to do the volar sweep. Again, now I'm gonna have my same contacts, right? The same contacts that I use for the dorsal sweep. Now I'm moving my second and third fingers away from each other, creating a volar sweep of that palmar aspect. And so this is the movement that's required for extension of the metacarpals. So it says increase the arch, index, and middle fingers, push dorsally. So push dorsally as the thumbs simultaneously apply a force away from the midline of the hand. And then that's to actually help with the dorsal sweep. Then to flatten the arch, the thumbs push volarly as the index and middle fingers simultaneously apply a force away from the midline of the hand. Now we have dorsal and volar movements of the hand of each individual metacarpal. So this is a joint play motion necessary for opening and closing of the hand. So if I want to do a volar movement of the fifth metacarpal, I'm gonna actually come across her hand, and I'm actually stabilizing the fourth, third metacarpal. I can stabilize the other one, but specifically I want to stabilize the fourth metacarpal. I want to make sure it doesn't move, and then I can do a dorsal. So, well, I'm doing a volar right now, so I'm doing a volar movement of that metacarpal. You see, so I'm moving it towards the palm, and then I can also do a dorsal movement, moving it dorsally, okay, towards the dorsum of the hand. So I got a volar movement and a dorsal movement. So now say I want to move the fourth metacarpal. Now I'm going to stabilize the third one. So that's why when I did the fifth one, I stabilized the fourth one. And so now I'm going to stabilize the third one for movement of the fourth one. So I'm stabilizing the third metacarpal and doing a volar glide of the fourth metacarpal. Then I can do a dorsal glide of the fourth metacarpal. okay? Then I can go stabilize the second metacarpal and do a ventral, a volar glide of the second, and then also do a dorsal glide of the second metacarpal, okay? Now, if I want to do the first metacarpal, what I'm going to come back and do, I'm going to stabilize the second one. All right, not second, third. I'm going to stabilize the third metacarpal, and then now I can impart a volar glide of the first metacarpal, and then I can do a dorsal glide of the fourth metacarpal. So this is, we're assessing the ulnar glide, or also referred to as a medial glide of the first metacarpal base on the trapezium. So I have to stabilize the trapezium, all right? So we're talking about a carpal bone, correct? So I'm gonna come right here like so. So right here, just below my radial styloid process, I'm gonna stabilize and grasp her trapezium to make sure that her trapezium is stabilized. So right here, I have her trapezium stabilized. It's not going anywhere when I do this mobilization. So I'm mobilizing her first metacarpal on the trapezium. That's why it's called a carpal metacarpal joint, all right, CMC joint. So now, if I want to actually assess the motion or component motion that's necessary for flexion, so flexion with my metacarpal moving towards my fifth digit. So now I'm going to have to get right here, and this is a technique that is better to do standing. And what I'm going to do is now mobilize and move this first metacarpal base in an ulnar direction. So towards the ulnar, or towards the fifth digit. And now this is assessing the component motion required for CMC flexion. But if I want to actually assess the component motion required for not abduction, for extension. So to assess the component motion required for extension, I apply my same grip, but now I'm moving the base of the first metacarpal towards me in a superior direction, or in a radial direction. So now the force is through my second and third finger pads. The force is coming towards me in a radial direction. Again, I still have to stabilize. I'm gonna come right here like so. So I'm still stabilizing the trapezium. So I'm not blocking my joint line. I'm gonna bunch up the skin. And now I can apply a ulnar or medial glide like so. Same thing with the radial glide, but I'm using these two fingers and bringing the first metacarpal towards me, or moving it radially. So now we're gonna assess the component motion that's necessary for CMC abduction. All right. Again, stabilizing trapezium and applying. So my now my thumb is on the palmar aspect of the proximal base of the first metacarpal. And now I can apply and assess the dorsal glide. And again, I would do this bilaterally, but this is the dorsal glide. So quick review, all. Majority of the time, and I'm gonna say majority of the time, or I'm gonna use the term most likely. Majority or most likely, your line of force is gonna be in line with your forearm. So you can do the posterior glide or assess the posterior glide in a sitting position, right? Based on the position of the person's forearm and hand. So in this case, if I want to assess the posterior glide in a sitting position, most likely the person's forearm is going to be between pronation and supination. So it's going to be in neutral. So it's going to be in between the both two. And then I can come in and stabilize the trapezium, right? And then I can use my thumb pads of my second and third fingers, and I can mobilize and move the base of the first metacarpal towards me, dorsally, all right? Dorsally towards me. And that gives me, but look at my line of force. My line of force is in line with my forearm, okay? So you wanna make sure when you go through and practice all of your mobilization techniques, check yourself and make sure your line of force is appropriate, because Dr. McClure and I are going to be looking at that during your mobilization techniques when you're assessing your component motion. This is a volar glide of the ulna, and this is the distal ulna of the radius. And so again, this is a joint play motion, considered a joint play motion that is necessary for supination. And so my right hand is going to come around her distal forearm. And so basically I'm stabilizing the radius, all right? And with my manipulating hand, I'm gonna actually flex my index finger at the PIP and slightly at the DIP. And I'm gonna come around and I'm gonna stabilize the triquetrum. So I'm gonna actually have my hand blocking. You see where my finger is hooked at? I'm actually stabilizing the triquetrum right here. Triquetrum and pisiform, all of those carpal bones are being stabilized. And again, I have the radius stabilized with my light grip right here, with the grip of my right hand, stabilizing the radius. And with my thumb, I'm going to impart a volar glide of the distal ulna with my thumb. So now my thumb is mobilizing the ulna in the volar direction. Taking my vice grip hand, which is my stabilizing hand, and again I'm stabilizing the radius. All right, taking the hook of my index finger, I'm coming around here, stabilizing triquetrum. And then now I'm mobilizing the ulna volarly, the distal ulna volarly, on the radius and on the triquetrum. So it's going to be a dorsal glide of the distal radius on the ulna. This is a joint play technique that's beneficial and necessary for all movements at the wrist. Stabilizing the distal ulna as now I'm using my thin arm eminence and hypothin arm eminence, and more so my thin arm eminence on the distal radius. And basically it's very simple. I can feel it and mobilize it dorsally. So distraction of the proximal carpal roll. So I want to distract the proximal carpal roll from the radius and ulna, and specifically more so the radius. And so I'm going to come in and I'm going to stabilize, right? Okay. So I'm going to stabilize the distal radius and ulna, making sure that the wedge is not blocking the joint line. And then I'm going to come in, make sure she's in a loose pack position. Notice I'm bunching up the skin. And now I'm going to distract. Okay. And so I can feel that. And so I'm not moving skin because I bunched the skin up, put in slight flexion, loose pack position, and now distracting. Now we have a volar glide of the proximal carpal roll. And this is a component motion that's necessary for wrist extension. So I'm gonna come up. This is technique that you want to do standing. I'm bunching up the skin, making sure she's in a loose pack position. So I just biased her in some flexion. I'm gonna unweigh. What I mean by unweigh? Distract. So grade 1 distraction. And now applying the volar glide. So the volar glide is in line with my forearm, going down like so. The dorsal glide is going to be a component motion necessary for wrist flexion. Same concept. I'm still going to bunch up the skin as much as possible. I'm still going to bias her in flexion. So notice, she's still biased in flexion. I'm going to unweigh the joint and then apply my dorsal glide of the proximal row or carpal bones on the radius. So now we're going to do the medial glide of the proximal row, which is also referred to as an ulnar glide. This is going to be required for radial deviation. Bunching up the skin, also making sure she's biased in wet. Flexion, loose pack position, and now I can apply my ulnar glide of the proximal carpal row, like so. So, again, making sure she had good alignment. Again, bunching the skin. So you see how it looks when the skin is bunched? Slight flexion for loose pack position. Unweighted joint with some distraction, and then gently glow into my assessment. So let's show you for ulnar deviation, right? So for ulnar deviation, now sometimes it's not comfortable to get the patient like this, right? So what am I gonna do? All right, this is what I'm gonna do. So for ulnar deviation, I'm gonna let her stay like this, all right? She's gonna stay just like this in this position. I'm gonna come here, I'm gonna bunch up the skin, I'm gonna distract, and then I'm gonna apply a radial glide, that direction. You see that? Make sure I keep her flexed. So I'm applying and performing a radial glide with her in this position. Can I perform an ulnar glide with her in this position? Yes, I can. So what I just did is assess the component motion required for ulnar deviation, which is a radial glide.